Anyway, let us go to our first guest.
I see the first guest is on the line.
Who should be on the line this morning. And with a touch of the button, we can say good morning. You're on KSJE. Thank you for calling in this morning.
Good morning, Scott. This is Jeff Bourgeois. How are you today?
Good morning, Mr. Bourgeois. I'm well, thank you. Great to have you on the program again to talk to us a little bit about what's the conditions at the hospital. I think we're seeing an increase in patients, are we not?
Scott, we certainly are. And it's as busy as we've been in a long, long time. This morning, around 6 o'clock, based on the report I'm looking at, we had a total census of 160. 49 of those were on our respiratory floor. Of those 49, 43 were confirmed COVID positive. We had 4 other negative COVID patient test results, but still nonetheless respiratory symptoms, so we're placing them on our 4th floor, and 2 patients who are pending a test result. So still, it's a very, very busy time for hospitals across the state, and we are no exception. We also have 8 total intubated patients, and both of our ICUs are very full.
Right, and Jeff Bourgeois, I just want to come on and ask you a little bit. Compared to, I think, the last update we received last week, I believe the census was more like 28. Does that sound about right? Maybe from maybe Monday or Thursday? Is that where things were, and now we're at 40 plus?
Yes, that would be generally correct. I can't remember the number off the top of my head, Scott, but it's
almost double, I think, is what I'm trying to say.
Yeah, it's increased that quickly, and as we look at our 14-day rolling average of the positivity rate of the tests we conduct, that's just for the tests we conduct, not related to any other testing in San Juan County that one might see on some of the state websites. So just for our hospital-based COVID-19 tests, we're at a level around 14 or 15%, which is approaching where we were at our peak back in May. So, and it's not showing signs yet that it's peaking. So, very concerning trends on the positivity rate within our hospital testing results.
Good morning, Jeff. This is Megan. I have a different question. Last time we saw this surge, we had to temporarily cease elective surgeries. Is that on the docket?
Hi, Megan. What we've done in one, working with the state and communicating our plan to them, and secondly, working with our anesthesia providers and our surgeons, is we will begin monitoring our metering, I should say, elective surgeries that would normally plan to have an overnight stay. We're going to begin reducing those and trying to reschedule those to the extent possible. It'll be a judgment call on the part of the surgeon and anesthesia provider in conjunction with the patient as to whether or not it's safe to postpone a case. So there are certainly those quote unquote elective cases that really need to happen based on the risk of continued deterioration of whatever is causing the need for the surgery. So we are starting that today, as a matter of fact, Megan, really looking at those elective cases that need an inpatient stay and making a case-by-case determination if we can push those off.
Understood. And Jeff Bourgeois, this is kind of what we see too from other hospitals, right? Taking these similar steps, looking at these things when they see an influx of, say, COVID patients and things like that, that you really kind of have to put your resources where they need to be at that given moment. I suppose you only have so many nurses, so many aides, so many doctors. All these things are finite resources.
That's correct. And this second wave, we lagged the state a little bit, and so the increase we've seen in this past week, as you know, Scott, really has been significant. What we have noticed is that hospitals down in the what we call the Central Core Albuquerque area and way south down to Las Cruces. They've had to implement steps like this a little earlier this wave than we have, but we're now catching up to that. So it's I think statewide, the hospitalizations were up over 500. That's a new record for our state as of this morning. So really a cause for everyone to heed all the recommendations that we've heard so many times over the past 9 months around COVID safe practices. Wear a mask, wash your hands, social distancing. Of course, we know the governor has a new 2-week shelter in place order that takes place today. Painful decision for our state leaders to make. But we've got to find a way to preserve hospital resources, and the entire state's hospital system is really being tested right now.
Yeah, understandably. And, we know that you guys were anticipating a second wave and that there's been a lot of pre-thought and planning that has gone into this. But there is something called a safe haven law for healthcare providers. And a lot of our viewers and listeners might not know about that. And I'm wondering if you could speak to that, if there's a lot of that happening. So...
Yeah, Megan, it's called the Safe Harbor Law, and it was put in place in our state either last session or the session before. And I'd be remiss if I tried to speak to the details of it, but it really applies to the registered nursing component of hospital and inpatient side, and it's a way to help protect them when they're put into difficult circumstances. That's about all I can really say about it. That's about all I can really say about it without having it specifically in front of me, because I don't want to misspeak. But we're not seeing a whole lot of it. And to answer your question, in terms of nurses invoking that, and nor has the state really seen that since the law went into effect.
Very good. Yep, we're just curious over here. Well, thank you, Mr. Bourgeois, for coming on. As always, we super appreciate you giving of your time and giving us these valuable updates.
It's a live update, Jeff. Thank you.
Hey, Scott and Megan, I appreciate it. I just would, ask that everyone really help our frontline caregivers by using COVID safe practices. 9 months, healthcare providers have been in this battle now, and it is physically and emotionally exhausting. So anything we can do to help support them, I think we'd be foolish not to, as general community members. They are tireless heroes on the front line, and this is not easy work in any way, shape, or form. So let's do everything we can to support them.
Very good. Good advice and good information. Jeff Bourgeois, we definitely want to keep our hospitals from getting overwhelmed. So thank you very much yet again. And we'll talk to you again hopefully next week, Jeff, if that's all right.
You bet. Look forward to it, Scott. Thank you.
All right. Thank you very much.